Data modernization at the Massachusetts Department of Public Health involves understanding what data we actually have and hold in the department, centralizing it as best as we can into one place, and bringing the epidemiologists and the data analysts into that centralized platform so they can be able to look at the data, use the data in a more holistic way to drive insights into our communities and various populations in Massachusetts. PHIG was a crucial part of Massachusetts Department of Public Health data modernization journey. It added some focus for the department on how we should center data modernization as core public health infrastructure. It helped us see that it's not about specific disease areas or topics, but everything touches data, and since everything touches data, we should look at it from a wider lens about how we can provide a department-wide strategy to use and disseminate data. Another way that PHIG supported our data modernization efforts was by creating the space and the funds for us to build our own DMI team. We have a dedicated team that is for the department that's all about data modernization and every day looking for new opportunities about how to move forward our strategic priority around data. So when PHIG first started out, we used the funds to help stand up the platform, our cloud-based platform, and we were able to get it up quickly after doing an assessment by using a vendor who was able to come in and provided the full suite of capabilities that we needed in order to get this started. They were our technical partners as well as our platform administration and management partners and support partners. But pretty quickly we realized that it was going to be a very expensive endeavor if we continued down that road long term. One of the things that we did was we've now switched to an internally based or internally supported model where our umbrella agency, we are now funding a data team in our umbrella agency who provides our IT support, who directly supports our team. These are 10 dedicated individuals who are able to do everything that the vendor was able to do and more. And by switching to this internally based platform, we're building long-term sustainability and capacity, as well as realizing significant cost savings to the tunes of millions of dollars. Through our vendor-supported model, we estimate that we would have spent around $3.5 or $4 million a year. And switching to an internally supported model, our savings or our cost would be about half that. Very high hopes for our data modernization journey impacting the lives of Massachusetts communities and populations. We are able to take our data, by bringing it into one platform, we're able to make it come to life a little bit more in a way that we weren't able to before. Data are not people. We try to use data to understand small facets of people's lives, and by taking all of these pieces and bringing them together, we can at least create a more holistic picture of what a person and their life experience looks like. We can take these data to inform our actions to positively impact people's health and lives.